We have plenty of vaccines and booster shots available at convenient locations and for no cost. There's clear guidance on masking to help slow the spread. And we have emergency medical teams to respond to surges as necessary. So this is not a moment to panic, because we know how to protect people, and we have the tools to do it. But we need the American people to do their part, to protect themselves, their children, and their communities. The more people get vaccinated, the less severe this Omicron outbreak will be. 160,000 unvaccinated people have already needlessly lost their lives just since June. And this number will continue to go up until the unvaccinated take action. So I'll say it once more: get vaccinated. With that, I'll turn it over to Dr. Walensky.
Thank you, Jeff, and good morning, everyone. I'd like to start by walking you through today's data. The current 7-day daily average of cases is at about 119,500 per day. The 7-day average of hospital admissions is at about 7,800 per day, an increase of about 4% over the prior week. And the 7-day average of daily deaths is at about 1,200 per day, which is at an increase of over 8% from the prior week. Now let me bring you up to date on what we know about Omicron. At least 39 states and over 75 countries have reported confirmed cases of the Omicron variant. And although Delta continues to circulate widely in the United States, Omicron is increasing rapidly, and we expect it to become the dominant strain in the United States, as it has in other countries in the coming weeks. We've seen cases of Omicron among those who are both vaccinated and boosted, and we believe these cases are milder or asymptomatic because of vaccine protection. What we do know is we have the tools to protect ourselves against COVID-19. We have vaccines, we have boosters, and we know multi-layer prevention strategies: masks in public indoor settings, practicing physical distancing, frequent hand washing, improving ventilation, and testing to slow transmission are vitally important, especially as we prepare for more Omicron, and even if you are vaccinated and boosted. This morning, I want to talk with you now about how we can use these tools to help keep our children in school. Over the past few months, CDC has collaborated with school districts across the country to evaluate a new strategy known as Test to Stay. Today, we're releasing CDC science on Test to Stay that allows unvaccinated children to stay in school even if they've been exposed to the virus, so that they don't have to miss school while they're quarantining at home. In the Test to Stay protocol, there's increased testing of close contacts after a COVID-19 exposure. And that testing needs to be at least twice during the 7-day period after exposure. If exposed children meet a certain criteria and continue to test negative, they can stay in school instead of quarantining at home. CDC is releasing 2 MMWR reports with evidence supporting the use of how well it worked in 2 communities, Lake County, Illinois, and Los Angeles County. These studies demonstrate that Test to Stay works to keep unvaccinated children in school safely. In order for Test to Stay to be implemented safely and correctly, some key prevention measures need to be included. In both studies, masks were worn consistently and correctly. Close contacts of a positive case were monitored for symptoms and stayed home if they became ill. And those who did not develop symptoms had regular testing. Test to Stay is an encouraging public health practice to keep our children in school, and CDC is updating our materials to help schools and parents know how to best implement this promising and now proven practice, along with our multi-layered prevention strategies that will help keep our children in the classroom safely. Importantly, vaccination is another critical piece in our multi-layered prevention strategies to protect our children from COVID-19. I'd like to take another moment to encourage parents to get their children vaccinated. Just yesterday, CDC's Advisory Committee on Immunization Practices met to discuss new safety data following 6 weeks of COVID-19 vaccinations in children between the ages of 5 to 11. We now have experience vaccinating over 20 million children under the age of 17, and over 5 million of whom are under the age of 11. Looking specifically at vaccine safety data from over 50,000 children 5 to 11 years old, we found no evidence of serious safety concerns. The most common reported side effect included pain at the injection site, fever, tiredness, and headaches, muscle aches, which we know are normal and are all signs that the body is building immunity to the virus. This further adds to the strong evidence of the safety of these vaccines for children and should be an encouraging reason for those who are waiting for more data to now feel confident in making the decision to get your child vaccinated. In addition to reviewing safety data yesterday, CDC's Advisory Committee on Vaccine Experts met to evaluate recommendations surrounding the Johnson & Johnson COVID-19 vaccine.